All right, Kristin, I'm looking forward to diving into this topic. It's been something on my to-do list, a topic to cover for quite a while, but I wanted to do it justice. And I thought, what a good person to chat about this topic with. I mean, as a doula, one of your biggest roles is to support mom. And so this podcast is all about how husbands, partners, support team can help the recovering mom. So thank you so much for being here.
Thanks for having me. I'm excited.
I This episode I think is important because so as a physio, that people come to see me because they associate me with physical symptoms that are bothering them, or maybe they want to be proactive in preventing physical symptoms. And honestly, every single one of those sessions is going to be sometimes about finding time, okay, for mom to, whether it be that she's feeling pain, so she needs more rest, or maybe she's feeling weak, or she has a desire to do more exercise, or she's having pain, so I need to give her some things to do. So often, the challenge in the session is just finding the time. And so I thought, oh, how do we do that? I think sometimes we have a hard time asking. It's hard to
Mhm.
ask. I think sometimes it's hard to, we feel selfish, maybe.
Mhm.
And so I thought, let's do it. Let's do something dedicated to the support staff so that maybe that takes some of the pressure off of mom. And
Yeah.
I mean, at the end of the day, our body is so resilient, but it needs some help. And let's get into this topic so that we can help support staff help mom.
Yeah.
Will will you will you tell everybody that's listening first a little bit about yourself?
Sure. Yeah. So I am a mom of three. So my kids are ages 6, 8, and 10. I'm also a Lamaze certified childbirth educator and a birth doula. So I teach local classes at a maternity clinic, Maternity Care West Side, and I also teach private prenatal classes. So education is such a passion of mine, and so I'm excited to be talking about this topic today. And I'm also a birth doula. So I support families in preparing for birth and then also in that immediate postpartum. I'm a board member and also the interior regional rep for the BC Doula Association. So I just love everything surrounding supporting families in this time. So
And I always appreciate like collaborative healthcare and teamwork in healthcare. And we've worked together on a few other projects before, so I appreciate that you're willing to kind of come at it from a team approach as well. Sometimes I explain to new moms or that moms that are going to have a baby soon that sometimes should think about it like going home from the hospital after a knee surgery with a new puppy and what that would look like. And I think we look at, can you imagine, I'll say, if your mom was going home after a knee surgery, everybody kind of knows what that looks like. We're going to come together to support mom. She's not going to be cooking for a while. We'll be doing the laundry, we'll get the groceries. We're going to prioritize mom resting. She needs to get her knee elevated. She
yeah.
would have been sent home from the hospital with some exercises to do because we know that exercise initially and movement initially helps long-term outcomes. So I think everyone has a pretty clear picture as to what that would look like. Quite often, mom would be sent home with maybe some crutches or something like that to offload her knee and just help it with swelling and pain management. And there'd be some follow-up appointments. It doesn't really look like that after having a baby. I think that it looks quite different, but we're trying, I say, well, let's try to mirror what it would look like after a knee surgery. And so tell me, don't you find too, I'm interested to hear kind of what do you see as differences though, Kristin, between someone coming home after a knee surgery and a new mom? I mean,
Mm.
I was very, you're sleep deprived. I think more sleep deprived. Also too, I think quite often we have so much adrenaline and this kind of hero mentality or this, I can do everything. What kinds of things do you see too? I'm not trying to generalize here, but just to kind of, I think a lot of this support staff, husbands, partners will be noticing like, oh, she's a bit different.
Yeah. Yeah. And I love that analogy because I think, yeah, when you come home from a major surgery, you know that you're coming home with support systems, and you've hopefully prepared, and you've spoke with the surgeon, and you're coming home with all the supports, hopefully, that you need to recover and to heal. And I think when you come home after giving birth or after cesarean, there's this expectation that you're going to figure it out. And there isn't necessarily those support systems in place. And so people prepare a lot for the birth. And I think that's so important. And just as important is preparing for that postpartum. And it's not just about the person that's giving birth preparing for the postpartum, but also the support people, knowing how they can really be those crutches for their partner, or whoever it was that has just given birth. So yeah, I think there is a lot of correlation. It's kind of funny to think of it that way. Like even bringing home the puppy, you're bringing home this tiny human that you're going to be taking care of when you're trying to heal and recover. So
Yeah, absolutely. And I think that I think a lot of new moms say, I didn't really think of this as an injury. I didn't think of my birth as an injury. And I stumble on that sometimes because birth is beautiful. It's amazing what our body does, but our tissues are stretched to the max and there is an injury, whether you have a vaginal birth or a C-section, whether that's a very difficult birth or a quote unquote easier birth, your tissues still need time to heal. There has been an injury. And I think sometimes just acknowledging that, because it helps just set the expectations.
right. And an unseen injury, I think, at that. Whereas if you
Yes.
come home with surgery on your leg, everyone sees that you've had that. Whereas if you've
Yeah.
just given birth, you're not necessarily seeing that on the outside, other than this baby that you're holding. But internally, you are healing for a minimum of 6 weeks. So
Yeah. And I think sometimes it's harder to talk about as well. So depending on your relationship with new mom, just knowing something she might be not be saying, right?
exactly.
So I think I kind of broke this up into themes to talk about. And just like after someone has a knee surgery, we would try to offload that person. And because you're coming home, as the partner too with a new baby, how can you offload both of you? Right. So just things like asking for help when everybody wants to help. If they ask, they want to help. So this is where some of the things you hear all the time. Yes, if you need groceries picked up, ask for food to be delivered. If someone says, what do you need help with? Whether it be cleaning the house, right? I mean, offload the team that's there, right?
Yeah.
Say yes.
Yeah. Exactly. And I think one of those ways that you can offload is creating a list ahead of time,
Yeah.
um, or even an ongoing list, so that when people say, how can I help? I think the easy go-to is here, let me hold the baby. And that's the
Yes.
fun thing, because everyone wants to hold the baby, but holding space for the parents and helping them, whether that's like loading a dishwasher, doing laundry. There's so much that can be really helpful in that time, other than just holding baby. So,
Yeah, exactly. And then also too, on the note of foods, I think, what's different here as compared to, well, I mean, every time we're healing, we need good quality food. But I think just, I remember one thing um, my friends would do is they'd make me lots of casseroles, but they all had like carbs and cheese and which was great. I needed some like fruits and vegetables stuck in front of me though too, because constipation was a real thing postpartum. And I remember thinking, when someone says what kinds of foods would you like, sometimes just like a veggie platter or a fruit platter or something like that. So sometimes putting some thought into what kinds of foods, like it's okay to be specific.
for sure. Yeah. And I would say postpartum nutrition is so important. And oftentimes it can be easy to go to the simple things of just going and grabbing a burger or fries, or because it's simple, it's fast, it's cheap. But what would really nourish your body, and just really thinking about that? love? Do you love fresh fruit? Well, if you're going to create a meal train or ask friends to support you in that, making a list, I think, is important. It's something that you mentioned, just what are your favorite foods? What do you not like? So that you don't have 50 casseroles sitting there that you're just not going to touch.
Mhm.
And then partners, I think, can often feel like that weight is on them, like they have to figure that all out. But there's lots of ways that you can lean on your support systems. So yeah, meal trains. There's also meal prep services that will literally drop the box off at your home with the recipe, all the ingredients, and you just kind of throw it together. Or order from your local favorite restaurant and order a little extra so that you have leftovers. So lots of options
Yeah.
that, you know.
And basically like I always try to think of like what are the things she definitely doesn't need to do, and meal prep is one of those. Right.
Yes.
So
Yeah.
there are things that she cannot avoid, but let's offload all the things that she can avoid. So that's absolutely one to try to figure out. What do you
Mhm.
usually tell people about visitors? Because this is something that we're always excited to show off our baby.
Mhm.
I probably would have been the one that's like, yes, so and so's coming this day, so and so's coming this day, so and so is coming this day, because I was excited to show off my baby. Sometimes my husband had to say, like, do you think that's too much? What suggestions do you have then for partner in maybe policing some of that,
Mhm.
or or just being mindful to not do too much? Because again, I think sometimes as new moms, we can be a bit irrational.
Yeah, yeah. And it's hard to find that balance. And that's why I always recommend having these discussions beforehand. So even before you have baby, talk about it. Do you really want to send that text to everyone on your your contact list to say we just had baby, and then you have people messaging you wanting to show up at the hospital or show up within a couple of days of you arriving home? So just discussing what you want those boundaries to look like so there isn't confusion or disappointment later on. Like, how often do you want them coming? Who do you want coming? Who do you not want coming? I think is also an important thing. And then partners can be the bouncer when it comes to those visitors. So maybe it's been a couple of days, someone shows up and they just want to come in and hold baby. It can be really hard to set those boundaries. But I think it's really important because it is a major transition. You're getting to know baby, and it's a new relationship too. As partners, you're trying to learn to communicate in this new way. And so in all levels, it's just a transformation that really needs to be protected and honored. And so it can be hard, but I think one of the ways that you alleviate some of that, those tough conversations later on, is setting those boundaries ahead of time.
Mhm. I had a new mom the other day that said she had been feeling great, but then she said we had a weekend full of company. It was Easter weekend. And she said, I definitely took, I had a lot more pain. I had a harder time sleeping at night because of the discomfort. And so she said, I think I should have maybe put some limits on that. But I think that's another thing, as you mentioned, that support staff can take over.
Yeah,
Overall, just how do you offload, the whole household, I should say.
yeah, yeah, exactly.
What about so if we think about supporting her new mom specifically, what are some just basic things that you have tips for the partner? What things in the day might not they think about that she needs to do that she doesn't, or sorry, she thinks she needs to do that she doesn't need to do?
Hmm. Yeah, I think a lot. I think there's a lot of pressure to do everything. And so yeah, I think re-looking at expectations and roles, I think, is important. So something I do in my classes, our group prenatal classes, is looking at your 24 hours before baby. What does that look like? Maybe someone works outside the home. Maybe someone does most of the cooking, etc. So what does that look like? And then what does that look like after baby? So no matter what your feeding method, about 12 hours of that is just going to be feeding. And then you want to make sure that at least a minimum of 4 hours is designated to either rest or sleeping for mom. So I think, yeah, reevaluating some of those roles and expectations and having those discussions like, okay, if she's the one that's doing most of the cooking, how is that going to shift? How can we create space where she doesn't have to do that and doesn't have to feel the pressure to do that after having a baby?
I think even if, I think of little things around the house, like I know you've talked before about kind of making the bed,
Yeah.
doing some work in the yard, taking out the garbages. I think, it sounds obvious that she doesn't need to do that. But sometimes something like making the bed, let's just not worry about it. Like if that's something that you usually do, maybe you just need to vocalize to her, let's not worry about this. Like, you
Right.
know what I mean? Or I will deal with this. And if I don't deal with this, let's not
Mhm.
worry about it. Because I think sometimes it's just we just put expectations on ourselves, whether our partner expects us to do those things or not. Right.
Yeah.
So I think
Yeah.
like just those little conversations, because again, I think of the knee person all the time. I was like, you wouldn't be doing all of this after. You
Mhm.
just wouldn't, you would give yourself a pass for making the bed and taking out the garbage. And it just is an unsaid thing. Nobody would expect you to. And I think too, same with the knee, is that, if you're up on that knee too much, doing some of those things like making the bed and taking out the garbage and cleaning off the countertops, you're probably going to end up with more swelling. I think everybody knows that. And we don't necessarily recognize swelling in our abdomen or in our perineum because I think sometimes we just don't have a great connection with this area, or we just chalk it up to having a baby. So no wonder I'm sore. But
Right.
if you were having that swelling, I would suggest as a physio, well, maybe we need to get you down, get your leg elevated a bit. Are you doing too much? And
Mhm.
in the case after a C-section or a vaginal birth, we sit a lot as new moms. We spend a lot of our time, like you just told me, how much time should be expected to feed. And quite often that's in a sitting position. But
Mhm.
sitting isn't really offloading gravity. It's actually, if anything, kind of gravity is bringing everything to pool in that bottom of the pelvis or in that incision area. And so I think just getting horizontal, spending some time encouraging her to get horizontal when she's not feeding the baby, right? Just like we would
Right.
with the knee. Yeah, sure, do a couple things, but then get down and get your knee up. Right.
Yeah.
So something as simple as dealing with swelling by getting horizontal can not only help with pressure, pain, but can help with less scar tissue down the road.
Mm. Wow. Yeah. Yeah.
Yeah.
And it seems like, wow, that's such a simple concept, but not something that someone would really
No,
think about
no. And I think
when, yeah.
sometimes she needs to be reminded. Remember, like
Mhm.
whether you put up sticky notes or whether you set a timer or whether you watch, and as soon as she's done feeding, remind her to get horizontal, because so many people say, like, when should I start dealing with scar tissue? Oh, well, you can deal with scar tissue very early on by eliminating swelling or
Right.
decreasing swelling, right? So
Yeah.
something as simple as that to remind, right? But two,
Yeah.
yeah, just, aches and pains. Can I rub your back? Can I
Mhm.
can I massage your swollen feet? Sometimes that
Yeah,
goes a long way too.
for sure. I think checking in too, um, like what do you need? Because sometimes the things that we don't think are necessarily a big deal might be a big deal for her. Like maybe you were like, you just don't need to make the bed. It's not a big deal. But for her, it might be having this bed made just makes me
Mhm.
feel better because so
Mhm.
much can feel so, um, what's the word, like chaotic maybe, or you can't control when baby wants to feed, or you can't control a lot. So there's certain things I think in that immediate postpartum that seem very menial, but can be really big for her. And so I've heard of some people having like these check-in times. Maybe one is strategizing and the other is just solely focusing on that emotional connection. So strategizing can be like, okay, I know this is really important to you. You need this bed made. So I'm going to do that for you to offload that. And then that next check in is like, okay, how is it going? Like,
Mhm.
how are your emotions? Like, how are you feeling? Because I think so much of, especially early postpartum, can feel almost like autopilot.
Mhm.
Um, because things need to get done. So it's like, hand me the diapers. I need the wipes.
Hmm.
And there's rarely time where you're like, hey, I totally missed that. Are you
Hmm.
doing okay? Um, yeah.
I think that's something that I often ask my clients when they come in. I say, why are you here today? Or like, what are your goals? Whether that be an online appointment or an in-person appointment. I mean, I see people as early as days after postpartum, just because I want to have a check-in for them and give them some advice or some peace of mind or something to think about. And when I ask them, what do you feel you need or what do you feel you want? Most of them don't know. I don't know. Right. And so I think that's a good practice,
Yeah,
it doesn't have to be a huge conversation, but just a regular check-in, just because we matter too, right?
for
Yeah.
sure.
Something I found helpful that my husband did was he was in charge of pain medications. I
Mm.
couldn't remember at the first couple of weeks, I was actually still in a lot of pain after my vaginal birth, but I could not keep that straight. And so what am I supposed to take again? What am I supposed to be doing? And so he just would kind of be like, hey, here's what you need to take now. I found that really helpful.
Yeah, that would be. Yeah, yeah, one other thing that can be offloaded from her where she doesn't need to think about that. And I
Yeah.
think yeah, especially with cesarean, that's important to stay on top of that pain management. Because even if you're feeling like, oh, I'm feeling good, and you don't take your pain medication for a little bit, you'll feel it later. And that pain, trying to keep up with that pain medication can be a lot more tricky. So I love that idea.
I've even had some new moms have said, my husband made me make this appointment, or my husband made this appointment for me. And I
Yeah,
always think, awesome, that
yeah,
is great. So something in them, the partner noticed she needs help, whether it be she's very active and I can see mentally she just needs a plan, or she just needs, even if, is there one thing a day that I can do? Or she has pain and she's putting it on the back burner. So that is absolutely something, good on you if you feel comfortable advocating for what you feel like what your new mom needs, right?
oh yeah, for sure. Yeah. And I think there's probably some hesitation, I think, with partners, like, I don't know, am I overstepping? Um, and I don't think so. Like, I think sometimes, speaking from my experience being a mom of three, like, we just need someone to step in sometimes and be like, you know what, you just need this support, whether that's like, I'm going to book you a massage, I'm going to book you in to see a pelvic floor physiotherapist, or and then there's that mental health piece as well, and just noticing when things just aren't right, and knowing when you need to seek some professional support, and not putting it on her like something's wrong,
Hmm.
but even saying, let's do this together, because I really want, it's about us, and it's
Hmm.
about us taking care of our baby, and so it's
Hmm.
less about her, but strategizing together.
Hmm. I think of something as simple as I find a lot of this stuff, people will hear it and be like, yada, 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 um, pass off the diaper changes. But I say, no, think about this as, again, similar to, for example, making the bed.
Mhm.
If after a knee surgery, you want to minimize pain and minimize swelling, then you have to offload some of your tasks. And something like changing the baby's diaper isn't something mom has to do. Obviously, if she's home alone, she does. But that's another thing that decreases the number of times that she needs to get up. And if you're wanting to, maybe she really wants to. A lot of my clients say, it's getting nice out. I want to prioritize a walk outside today. So
Right.
I talk a lot with them about, well, then what's going to give and take, because my next question would be like, well, how are you getting through your day? Are you finding you can get through your day without symptoms? And if she says, no, I feel pressure and heaviness, and I don't necessarily want her to add extra. Okay, well, what can we change? Because sometimes they'll say, we've had a lot of company, or I tried to do more today. I tried to clean the house. So then we talk about give and take. And so, what can you give so that you can take? So, for some of the things that are on your wish list for today. So, I think coming up with that, because I think a lot of
Mm,
times people want to get out as a family in the fresh air and in the sunshine. So, what
yeah.
things can you take from her?
Yeah. And for that, I think a simple thing of just familiarizing yourself with like the stroller or the
Mhm.
carrier, the baby carrier, and offloading that, I think,
Yes.
is a simple thing. Um, yeah, some of them are actually really easy, and it's just a matter of like a button and
Mhm.
they pop open or
Mhm.
pop down. And if she doesn't have to figure that out and you can push the stroller or carry the baby, I think that's a huge way to help her.
What are your suggestions then? Because I can picture some of my friends or some of my clients that have said, admittedly, I don't let him do any of that. I feel like I'm better at it. So I just do it all the time. And then I think that makes dad or partner take a bit of a back seat because he doesn't feel as confident or he knows that she knows it so well. What are your suggestions for that? Because I think some of these partners will listen to this and think, well, I've tried, but she won't let me.
Right. Yeah, that's a hard one. And I think with hormones after just having a baby, there's like this protective thing, like, oh, like the mama bear. We've all heard of
Mhm.
mama bear, and it's a real thing. And it's hard sometimes to just let go and trust that, he's not going to hurt the baby by changing the diaper differently than I do. And I remember having those similar feelings as a new mom and realizing that it was really impeding my husband's relationship and connection with our kids, because it would be like, no, that's not how you do it. And I had to just step back and be like, okay, if he puts the diaper on a little bit different, that's not going to hurt the baby in any way. Or if he, um, you know, I don't know, simple things, if it's not hurting the baby, allow him to figure it out too. Um, and sometimes even journaling can help with that. Like, to get your thoughts out onto paper. Like, what's causing me anxiety? Because I think there's a difference between, that normal postpartum adjustment of, just trying to figure all of this out and having that mama bear instinct and the hormones going, and then also anxiety and postpartum anxiety, which is something that would have to be, diagnosed and treated. And so, yeah, I think it's a complex answer and a complex issue, but I think really just becoming aware of those moments where you're doing it and just stepping back and be like, okay, do I really need to do this? Because it can really affect partners' connection and bond with baby. And it is really important because they that paternal bond is created through interactions, simple as like just smiling at baby. Um, and so if we, as the individual that has given birth, can create space for them to do that, like, hey, you know what, in the morning, that's your space to just be with baby for, an hour or whatever it is until they're hungry. And then you go in another room so you're not looming over them. I think there's just different ways of kind of managing that.
Yeah, and I think as dad slash partner or mom, whoever's there to support you, I think that even if you come at it just without it, no, I'm doing this, but just can you just give me the chance to try? Because I think sometimes mom just might need to gain the confidence, right? And it's just, just can you just give me one chance to try, or can you teach me how, or something like that, just to make it a
Yeah.
bit of a more of a um, gentle interaction. One other thing, I'm kind of bouncing around topics, but I just thought of this, that, what, if someone came home right after a knee surgery, they might have a hard time getting in and out of bed without a bit of help. Maybe someone has to kind of hold their leg a little bit or something like that. Quite often there's certain movements that new moms describe to me all the time that gives them either pain in their incision after their C-section, or maybe pressure down in their perineum. And so I always say, like, you want to try to avoid pain and pressure the best you can. So even something as simple as you watch her try to get up, and if there's a movement she's always having a hard time with, it might just be a couple days that you need to help, whether it be you support her from the back to sit her out of a deep chair, or you come under her shoulder and her side to help her get up from laying on her side. Sometimes that can just be a couple days, but if you're seeing wincing in pain or her holding her breath and trying to brace because she's anticipating discomfort, that would be a good time to to help, or say, can you ask me to help you? Because some of those movements that are repetitive and causing pain can be your body's way of saying, if you keep doing this, I'm going to blow a stitch, or
Right.
you know so
Yeah.
but pushing through that discomfort, it
Mhm.
is generally not helpful.
Right. And
So
our
watch
bodies will
that.
tell us, that.
Yeah,
Like you
exactly.
see this all the time, I can imagine in your practice.
Yes.
I only see it a little bit where, a client will be like how far is too far or how
Yes.
much is too much? And I'm like, we it's hard to you can't just say, well, read this book or here's I think it's different for everyone, and it's
Yes.
about listening to your body. And sometimes we do push too far, and then we start bleeding more, or our bodies will tell us.
Yeah. And I think that's where I usually say, like, that's when you should reach out to someone for help, because that's why I don't have blanket guidance for people after. I like to say, email me when you have your baby and let's set up an online appointment so you don't have to leave the house with your pukey PJs on. You can just keep your hair messy, unshowered, and we'll get onto a call and I'll say, how are you doing? What things are you having a hard time with? And then let's talk through the things you're having a hard time with. That's what I want you to do. Yeah.
I love that.
And I think one of the messages I usually give to people, because they come in saying, okay, what do I need to know? Like, do I need to stretch? Do I need to exercise? Do I need to rest? And sometimes I say, do you know what? Just start with finding some time. So maybe there's a way you can have this discussion as a partner with the new mom and say, um, is this a good time I can take the baby and you can go into the room, whether it be just 5 minutes or 10 minutes. But I say, once you're used to carving out the time, we can fill it with anything.
Hmm.
Maybe it's just
Right.
that you need to breathe, because you have a lot of tension and your nervous system is very upregulated. Maybe you need to stretch. Maybe you need to do some exercises. What do you want to do with that time? It's always that it's hard to find the time. So that would be
Yeah.
something also I suggest as a partner, is you try to build that into your day in some way, that she's able to leave baby,
Yeah.
and go somewhere by herself for a short
Yeah.
period of time. Yeah.
Yeah. Yeah, it's so true. Like finding that time is probably
The
one of
hardest.
the biggest hurdles to navigate.
Once you have the time, we can fill it with anything you want, though.
Yeah, yeah,
Yeah. Yeah. And that's the fun part. It depends on the person.
right.
Um, what do you usually say then? Because you've touched on the fact that sometimes we need, partners might be noticing, like, I think she needs some more help emotionally.
Mm,
I had a client the other day who definitely was saying, I'm really, really, really struggling with not having my baby on me at all times. And so her husband, made sure she followed through. She knew she needed to book with some sort of mental health therapist, but she just
mhm.
wasn't getting it done. So he helped her execute that. What other suggestions do you have maybe for partners listening? Because this is so common. You
Right.
know, it might just be that she talks it through with you, what she's feeling. Maybe she needs to talk to a friend. Maybe she needs to, you mentioned journal. Can you
Mm.
talk a little bit about that? Because maybe sometimes, a partner's listening to this and think, I think she needs more help. What are your suggestions?
Yeah, no, that's a really important topic and something that I always make sure that I mention, whether it's a private class or a group class, is knowing the signs, because it's very normal in the early postpartum, like up to 2 weeks after having baby, the normal postpartum adjustment of feeling emotional, having feelings of like, oh my goodness, am I doing this right? Or even feelings of regret, like, what did we get ourselves into? Um, but then if these feelings are lasting longer than, that immediate postpartum of about 2 weeks, and she's not able to take care of herself or the baby, she's really struggling emotionally, maybe feeling very anxious. Um, she is not eating. Yeah, like there's lots of different signs that you can be aware of. if you're noticing that, just to open up that conversation, just a gentle conversation of, hey, this is what I'm noticing and I really want to support you. Like, how can I support you? And then maybe she can just say, you know what, yeah, I'm not feeling like myself. And then figuring out together what the next steps might look like. So I think the first thing is make sure that you have that conversation. If you're noticing any of those signs, bring it up. Because if you can catch that early, it's treatable. All perinatal mood and anxiety disorders can be treated through professional support. So some people are like, I don't want to go on medication. Like, I want to avoid medication. And you can discuss that. Like, it doesn't have to be an all or nothing, but I think it is really important to seek professional support.
And I think, like, if I was to summarize my advice to partners from a physiotherapy point of view, it would be, again, to go back to the picture of the person with the knee and picture what that person would need, how you would band around them. And then also to, that some of the care that you provide in those early stages will set them up for success later down the road. I see lots of moms come in months down the road and they say, oh man, I can't run with my husband, which is affecting our relationship because I'm peeing my pants, or we cannot have intercourse because it doesn't feel the same, or I am so unhappy in my body and I haven't had time to exercise, or you name it. But the partners are hearing these stories. And so I think if you think about in the early stages, how can I help this person that I love set themselves up so they can get back to some sense of, what motivates them and what made me fall in love with them in the first place before we had this baby. And I think sometimes it's just, we have such a hard time picturing that a birth in any way resembles a knee recovery, but it very much does in so many ways.
Yeah.
And so I think just thinking about that, or helping her think about that, because sometimes it's hard to ask, or it's hard for her to see that her long-term health matters as well. So I think from a physiotherapist, that's my push, as these your wives or your partners are coming in sometimes struggling physically. And so and I know that affects your relationship. I know that affects her relationship with herself, her friends. And so think about that, and think about how you can play a role in helping her care for herself. What about you? What about, in summary, as a doula, what's your overarching message to partners?
My overarching message, I guess it would be that there are so many ways that you can support her. And I think oftentimes we go back to like, well, I can't do this, or I'm not good in the kitchen, or if she's breastfeeding, I can't support her in that. But like turning the table and saying, how can I support her? So like maybe it's bringing baby to her for night feedings, or reaching out to people, to help out with meals. So I think there are always ways that you can help, and it's just about being creative and ultimately, if you can really support her and support your connection as a couple in that early postpartum, it's really going to pay off later on. And so I think comparing it to like that knee surgery, if you really take care of that knee early on, right after that injury, that's going to pay off down the road when you're not going to be limping or, leaning on those support systems. So yeah, I would say just really be there and be creative in the way that you support her.
So, and I think that's obviously part of your role as a doula. So I think some people listening might think, you know what, this is something that I'd like to invest in for us. So I would like you to just also just share again, kind of some of the things that you offer, just in your prenatal class. You'll talk about a lot of this, but then also too, on an individual level with families, you support them in a lot of these topics that we just covered, correct?
Yeah. Yeah. So I am a birth doula. I don't do postpartum work.
Oh, sorry, Kristin.
Yeah, no, that's okay. I definitely, in that prenatal visits with clients, I create space for them to, what do you want to talk about? Because there's so much in terms of birth, postpartum, etc. And so they're like, yeah, you know what? I'd like to spend a whole session just talking about how to prepare for after baby. I'm like, that's awesome. Let's do that. Let's prepare, because I think that's really important. But I do private prenatal classes as well as group prenatal classes. The group ones are at Maternity Care Westside. So right now they're once a month, but they've been filling up. So we've been doing some months, 2 classes a month, and they're on Saturdays from 9 until 2. And yes, and then I provide birth support for clients.
Great.
Yeah.
Great. Well, thank you so much for your time. And I hope that people found this episode helpful. We look forward to hearing your feedback, and I'll leave information for how to reach out to either of us in the show notes. Thanks.
Thanks, Mel.